Hi, I'm Gabriele Riccardi, Professor of Endocrinology and Metabolic Disease at the Federico II University in Naples, Italy. I have been involved in the preparation of the recent guidelines for the management of dyslipidemia, particularly drafting the part of the guidelines related to lifestyle change. I think that these guidelines give a substantial contribution to motivate the people, the physician, the dietitian, and nutritionist to implement lifestyle because there is new evidence in support of this preventive strategy. This table describes the intervention strategies as a function of total cardiovascular risk and untreated low-density lipoprotein cholesterol levels. You may not be surprised by realizing that lifestyle intervention is recommended in people who are treated with drugs, hypocholesterolemic drugs, since it can improve the efficacy of the drug and improve also the overall lipid and cardiovascular risk profile. But lifestyle advice is recommended also to people in whom it is not appropriate any drug treatment. These people represent more than 50% of the general population, particularly the younger people. Yet, 1/3 of all the cardiovascular disease events come from people who are at a low or a moderate risk. Therefore, if we want to reduce substantially the number of events in the population, we need a more general approach which involves everybody in changing their lifestyle habits. This slide depicts the relationship between LDL cholesterol levels and the incidence of coronary artery disease in 3 different settings. Randomized controlled trials, in which the duration of the study can be up to 5 years. Prospective cohort studies, where the median follow-up is around 12 years, and Mendelian randomization study, which include people in whom plasma cholesterol levels are modulated by polymorphism of multiple genes, and therefore their plasma cholesterol level starts from conception to be influenced by these genes. As you can see, in all 3 settings, the relationship between LDL cholesterol and coronary artery disease incidence is statistically significant, linear, and positive. However, the magnitude of coronary artery disease change is 3-fold greater for, let's say, 1 millimolar change in LDL cholesterol levels in people who are evaluated in the Mendelian randomization study as compared to those who have been involved in randomized controlled trials. This suggests that the coronary artery disease risk is linked not only to the level of plasma cholesterol, but also to the duration of the exposure. Therefore, reducing cholesterol levels early in life by lifestyle intervention can be much more effective for cardiovascular disease prevention than starting the intervention with a drug, an hypocholesterolemic drug, later on in life, maybe when symptoms of cardiovascular disease start to become apparent. But what are the major features of lifestyle change which are able to influence LDL cholesterol levels? Well, there is extensive literature about the role of saturated fat, fiber, phytosterols, and other components of lifestyle intervention. What is new in this guideline is that the evidence is becoming stronger and stronger due to the accumulation of new intervention study and also many new meta-analyses. What we want to underline is that this lifestyle change have an additive effect on plasma cholesterol levels, and therefore they can give a substantial contribution to reduce the cardiovascular disease risk. Actually, combining some of these combinations like reduction of saturated fat, dietary fiber increase, weight reduction, and the use of foods enriched with phytosterols, you can get as much as 30–35% reduction in LDL cholesterol levels. And this has a very huge impact on coronary heart disease reduction, almost comparable to what could be achieved by drug intervention, particularly if the use of this lifestyle modification starts earlier in the early adulthood or even in adolescence. The guidelines give also some indication on dietary supplements and functional foods for the treatment of hypercholesterolemia, describing those which are more effective and those who are instead not to be advised because the evidence is not so strong. However, the cornerstone of a lifestyle change to lower low-density lipoprotein cholesterol and improve the overall lipoprotein profile is to make the right choice of foods that should be preferred in the everyday life. These new guidelines emphasize not too much the food that should be avoided or used only occasionally, but rather it gives some importance to food that should represent the everyday choice, like whole grains, fruit, vegetables, legumes, fish, and also the cooking procedures which utilize less fat, like grilling, boiling, steaming. It's much easier to recommend people what they should eat rather than telling them that there are foods that they should not eat. We think that the guidelines may represent a very important contribution to physicians, nutritionists, dietitians to help people in the general population, hyperlipidemic ones, to make the right choices to modify their everyday diet and improve their lipids and reduce their cardiovascular risk.